I think there is no reason that a primary care provider, whether it's an internal medicine, a family physician, can't do this. Because the first question that you have to answer when someone wants to make headache a medical complaint is the headache that the patient is describing to me a primary headache or a secondary headache? If you can think about it, primary headache is the disease. Secondary headache is the symptom. So for your secondary headaches, you treat what's causing it and the headache goes away. That is by far and away the minority of headaches that a physician or provider will see in a clinical practice. Overwhelmingly, it is going to be a primary headache. 94% of the time in primary care, it's going to be migraine. So if they learn the basics of taking care of migraine, they're going to be able to help a lot of people. And migraine is very common. It's thought that 12% of the population, 6% of the men, 18% of the women are going to have migraine. A third of women in their reproductive years are going to have migraine. It is the fourth leading cause of disability in women, the seventh leading overall. So we have a lot of individuals out there who have this condition, and it is incredibly common, and it is very easy to take care of in the beginning if we know the basics. Learn how to recognize it, understand what brings it about, what makes individuals vulnerable, and primary care can do a tremendous job and really not need to refer as much as they do. I think I will frequently speak to residents to try to interest them because we have a headache fellowship. And I'll ask them, always starting off, how many of y'all like seeing headache patients? Almost all of them put their hands and they're sitting on it because they don't want, no, I don't want to start seeing these people. And I point out to them, I honestly believe that's because you don't know what to do for them. And anytime we're confronted with a patient that we don't know what to do for them, we start to feel bad ourselves, and we don't want to be put in situations where we feel bad because, gosh, I got into medicine to help people, to bring them along and to have them feeling better. And when I don't know how to do that and I see someone suffering in front of me, I just don't want to be around this. And so I give them some basic tools that they can use. And the first few times that you have someone coming in with a devastating headache, and then you get them better within 10 or 15 minutes without altering their consciousness. They walk out pain-free. You go, my God, I did an incredible thing today. I feel good about what I do. And when you see that, you recognize you give people their lives back. Very often, I'll have women come in and say, I'm tired of being the mommy who has headaches. I hear my children whisper, shh, mommy has a headache. I have men come in and say, I'm about ready to lose my job because of my headaches. And you see how it can take over a life. And it's not like, it's not that pain control at the end of the life is unimportant, or say, hey, we cured your cancer, but then your heart attack kills you at 6 months. Because primary headaches attack people during their most productive years, between 20 and 55. This is when we're in college, we're starting our families, we're starting our careers. You get people's lives better at this point, they're able to do so much more. And that's what I find so attractive about it, is that you can really give people their lives back.